The surgeon said I have good news and bad news. The good news is the procedure itself was a success. The bad news is you have such extensive arterial sclerosis that we have to take you back in for open heart surgery probably in the next week. After they were done giving me a triple bypass, they went to take me off pump and it was unsuccessful. I had been in triple organ failure, my heart, my lungs, and my kidneys. I had 2 collapsed lungs, and I had been internally hemorrhaging. I was in dire straits at that point, and they were just hoping they could get my heart to start. So they did an emergency procedure. They had to put lung tubes in. They took a scalpel and they cut through my skin, and they jammed the tubes in, but the anesthesia they used on me wasn't working. I think they were more concerned with just getting me to breathe than what was going on with the pain level. It was a horrifically painful situation to have lung tubes inserted and taken out without any anesthesia. It took a while, but I did stabilize. I still wasn't in good condition, but I was stabilized enough where they can have a dialysis technician come into my room and do dialysis right there. They put an IJ in me, and they had to change it every 2 days when I got my dialysis done. At first, I didn't give it much notice, but after about 2 or 3 dressing changes, it started being traumatic. Not just for my skin, but psychologically. The level of pain was so severe, I would put it up with them inserting lung tubes without anesthesia. Who would have thought that just taking off a dressing would cause such immeasurable pain and anxiety for a patient? That they had to actually sedate me. I never would have thought a dressing change amongst everything else that was going on in my hospital stay would be so significant to me. I had extremely invasive procedures done, but what was at the top of my mind were the dressing changes. I see a huge opportunity for nurses and clinicians to really help their patients on so many different levels if they would consider the skin as important as any other vital organ. It takes so little time, yet it can change the entire patient experience if they were just cognizant of making sure that every time they change dressings, they use something to protect the patient's skin.